Oh, how are you?
Fine.
I'm Ruth Sanford, and I will be 100 in March. All my life, I never thought about birthdays.
Oh, Ruth Sanford is so full of life. I mean, she brightens up every single room she walks into. That kind of dynamism is very unusual in patients. Pretty soon I'm going to catch up with you. I know, we'll look like twins. She was extremely ill back 6 years ago.
I remember when I used to walk with my mother before the operation. She would only go a few steps. Eventually we went to the heart doctor, different doctors. They were going to do open heart surgery on my mother. And my brother, who's in California, he's a urologist, he said, why do you want to do that?
And the problem was that in a little lady, 95 years old, that type of surgery is incredibly insulting to the body and many times carried a lot of risk. Sometimes patients were deemed non-surgical because of their frailty at that age. Thank God we were doing trials already in the University of Miami in transcatheter aortic valve replacement. She was able to be treated with a minimally invasive technique without general anesthesia, with just local sedation and mild conscious sedation, and she was able to have her valve replaced and be out of the hospital in a few days.
Mother said today, even coming here today, this is 5 years later, she says, I don't know where they did this thing. I don't remember any parts of me open, nothing. What happened? Yeah, no incision. It was amazing.
Patients that are sick and need options for therapy can always rely on hospitals, university hospitals that are doing active research, because active research is the cutting edge of medicine.
My mother could only take a few steps at the beginning. Today it's completely different. Really something. It's amazing.
So I went out on the golf course. This was after the operation. I was in the sand trap on one of them, and I hit the ball. Not far, but I hit it. And then I started to play again for a little while.
It means so much that my mother has been around all these extra years that she has and everything. These procedures, if they can be done and people could live a fuller life, why not? I mean, it's wonderful.
Ruth today is alive because of these new technologies, transcatheter aortic valve replacement. I mean, clearly she has fabulous genes, and I only hope that I'm half as good as she is if I reach that age.